Hey everybody, it's Dave Juno, the Meniere's disease warrior. How y'all doing? I'm doing pretty good. I know I put out a video earlier today, but this one I'm literally tired of. Um, and it's Epsilon, SPI-1005. We People are talking about it all the time and all this other garbage. Okay, somebody today took an article from December 1st, 2025, which is recent. It's almost 2 months old, and decided to say, finally, it's approved. Okay? It's not approved. Okay, it's not. And I don't want people thinking it is. And I don't want questions. Do I know when it's coming out? I have no idea. I don't work for the FDA. I don't work for the Food and Drug Administration. Okay? So I have no idea. So stop asking me. I'm one of those people that, you know what, when it comes out, it comes out. I'm not one of these people that are hanging all my hopes and dreams on it, waiting, a year, 2 years, 3 years. I'm just not one of those people. I'm going to live for today and worry about tomorrow. Tomorrow. Okay? I'm not going to worry about today. So let's get into it. And the reason why I'm making it is because, Sound Pharmaceutical is the only one putting things out about it. Now, I'm not saying Sound Pharmaceutical is bad company. They're not. Okay, if they're looking into this for Meniere's disease, that's awesome. Not bad company, but you got to understand something. They're the only ones putting out anything about it. And of course they're going to do that. Do you know why? I'll tell you why. Because they're looking for investors too. This takes a lot of money to do. It's not something that the FDA says, okay, it's approved, and then all of a sudden it comes out in 5 seconds. It doesn't work that way. Even if when they approve it, it's still going to take time for it to come out. They have to build facilities, they have to build manufacturing, they have to, retrofit machinery. All that takes money. So yeah, they're looking for investors. They're looking for things. That's why they keep putting this stuff out. And us people who are extremely desperate sit there and go, it's finally happening. No, it isn't. It isn't. I mean, read the whole article. Okay, and it's from December. And you can go on Sound Pharmaceuticals website and read the same thing I'm looking at. They're pleased to announce that the FDA has granted its investigational new drug, SPI1 Breakthrough Therapy Designation for BTD, Breakthrough Designation, for the treatment of hearing loss in patients with Meniere's disease. Fantastic. MD is a complex inner ear disease that involves low to mid-range, mid-frequency hearing loss, tinnitus, vertigo, dizziness. This is the first BTD grant for the treatment of Meniere's disease, for which there is no FDA-approved drug treatment. Definite MD requires audiometric documentation, low to mid frequency hearing loss. Well, probably MD doesn't. I don't know what that means. In addition, SPI-1005, an oral anti-inflammatory, is the first drug to receive a BTD. Now remember what BTD means. Okay? Remember what that means, BTD. Breakthrough therapy designation. Okay, because I'm not going to keep repeating that. Involving the treatment of senoral hearing loss, the most common disease of aging and of peripheral and central nervous system. Documentate pure tone audiometry and speech discrimination testing, including the words noise win test, which together serves as a goal. Okay. I'm going to skip some of this other stuff. To date, no significant drug interaction has been observed with it today. Okay, but this is where they're getting into the investigational to make sure there's no side effects and things like that. SPI is being developed for several neurootologic indications, including Meniere's disease, hearing loss, tinnitus, intermittent dizziness, episodic vertigo. Two types of ototoxicity, hearing loss, tinnitus, dizziness, vertigo, caused by, I can't even say it. I'm just going to say antibiotics such as tobramycin, inicalcin, and platinum-based chemotherapy. That's a new one for me. I never heard that. But, okay, sounds good. Such as cisplatin and carboplantin. To date, there is no significant drug or drug interaction that has been observed across multiple studies, including Meniere's disease, patients with cystic fibrosis, bipolar mania, treatment-resistant depression. 13 completed SPI 1005 trials have treated 790 patients, with over 400 more enrolled patients over the next year, anticipated over the next year. Okay, this is not anywhere close to being approved yet. And the one thing they do skip here is called NDA approval, which to the U.S. Food and Drug Administration, the FDA, official authorization for a pharmaceutical company to market a new drug, granted after rigorous review of the new drug application. Comprehensive submission providing that this drug is safe, effective, and properly manufactured, with benefits outweighing risks for intended use. That's what they're going into now. They haven't done that yet. So now they have to go into this trial. That's why there's people, over 400 people they're trying to get for a trial. Well, this was made in December 1st, so for this year. So as of right now, don't count on this drug coming out in 2026. Don't. Okay? An extensive application contains data from lab, animal, extensive human trials, phases 1 to 4. I think they're just starting 4 now. So, it's not approved yet. So stop saying it is, because you see this. Oh, it's getting a breakthrough therapy designation. That doesn't mean it's approved. That's just that fast track that they were talking about earlier. Okay? I know some people are saying I took it and didn't do anything for me. And I'm pretty sure there's a lot more of that than they're telling you. And like I said, is it going to work for everybody? No. It's going to be like beta histine. It works for some. It doesn't work for others. Is it going to be a good thing to try? Yeah. But also remember one other thing. It might not be covered by insurance in the beginning. New drugs generally aren't. Okay? In the beginning, because they want to see real life. They want to see if it's working. Okay? And I don't blame them. Insurance companies, they're there to help us, but you know what? They're going to make $1 too. So I don't blame them. And it's going to be very expensive. Okay? Look at Ozempic today, and I was talking to a pharmacist about it a couple of weeks ago. If you don't have diabetes, type 2, you're paying for Ozempic out of pocket. Up until, I think, 2 more years, because it's a 5-year patent. So it's 2 more years, then it can go generic. But you're paying about $1,500 to $2,000 a month just for that? Because if your doctor just prescribes it for weight loss, they're not going to pay for it. Insurance is not going to pay for it. I can tell you right now, Medicaid won't pay for it. You have to be a diabetic for them to get it paid. Okay? I mean, I paid, I think it's $7 a month? But yeah, the guy's telling me, he goes, so he had an argument with somebody, when I went to pick up my Ozempic, he had an argument with somebody right before he came in about Ozempic, because his insurance wouldn't cover it. Because it wasn't for diabetes. It was for weight loss. So they're not going to cover it. And it's going to be, it's going to be similar for this. Technically they did cover it for Meniere's disease, but they probably want to make sure. So in the beginning, it's going to be very, very expensive. Okay. And I don't believe compound pharmacies would be able to make it in the first year, I think. I know if someone's gonna say, "Well, they make beta histine." You know, beta histine's been around forever, so yeah, they can make that. But Ozempic, it's like a formula. It's like Ozempic, they can do it now. It was after 3 years or something, or they have to. The pharmacy has to buy the license for it in order to make it. Um, but yeah, it's still going to take a while. And like I said at the beginning of the video, don't ask me when it's coming out. I don't know. I don't work for the FDA. Okay? I mean, this drug is causing a lot of hoopla in Meniere's support groups. And, I really do hope it works I would hope it works for mostly everybody. I really do. Because someone's going to say, well, you just don't want it to work. You don't want it to be passed. That's bullshit. Um, I want it to pass. I want it to work for everybody. But I also got to be realistic. Okay? Some of us do tend to live in a fantasy world. And there's nothing wrong with that. But you've got to look at things in reality. There's no cure for Meniere's disease. This is the first, I believe, drug that you're trying to help with hearing loss, tinnitus, vertigo, dizziness. That would be awesome if it works for everybody. But from what I've heard from some people who respond to the posts that people make, I was in a trial to get the medication, and it didn't work for me. One person, I was in a Zoom meeting, and one person said, I was in the trial where it was 28 of us. We all got that medication, Epsilon, and only 3 people made it to the end. And here's another thing, too. It's not a medication that you're going to take it for 10 days and then everything's going to be fine. And I think that's what some people are thinking. Oh, it'll be like an antibiotic. I could take it for 10 days and then I'll be fine. No, you have to take it the rest of your life. Because as soon as you stop taking it, everything comes back. Within time. Okay? Within time. It's going to take time for it to build up in your system, and it's going to take time to come out of your system. So on that note, I just wanted to, clarify that if you're going to post something, read what you're posting. Okay? Look into what an NDA is. Read the whole article. Don't just see the title that says Sound Pharmaceutical received FDA breakthrough therapy designation for SPI. Don't just read that. Don't just read that title and then go, it's proved. It's not. Okay? So on that note, I'll talk to you all later. Take care. Bye. And I know, well, before I leave, I know a lot of you are going to get mad. Some of you might leave. Whatever. You know what? I hate to tell you something. Like I said before, I deal in reality. And the truth of the matter is, it's not anywhere near being approved. Stop putting your hopes up on it. When it comes out, it comes out. And I hope and pray that it works for everybody. Somebody asked me, well, would you take it? I said, well, if I didn't have all these operations, I might. I probably would. But I've had the operations. It's not really going to do much for me. Okay? The one thing that was intriguing, though, was somebody in that post commented that they're trying to do a trial with cochlear implants, too. I'm pretty sure that might mean will it make the cochlear implant work better? That would be awesome. Then I would take it. Then I would definitely take it. I'm having good luck with my cochlear, but that would be awesome. So, on that note, yeah, like I said, have a nice weekend. This is it for videos for me for a while. I'm done. Unless I find something else that pisses me off. Or that makes me think. Or might help somebody. So other than that, I'll talk to you later. Bye.